Welcome to LSR Live. It is so good to have you all here for an important discussion, this time about dental health. I'm your host, Scott Ritzema, and I want to mention next week we're going to talk about exercise on the new year. So that's a pre recorded one with LSR's own Aaron and Lauren doing actual exercise routines. So be sure to come with your exercise clothes on and ready to go in the privacy of your own home, and you can learn some exercise tips or just watch and enjoy and take notes. But we're going to be welcoming our guest, Dr. Linnell DeRue, RDH, as we discuss everything from the connection between oral health and your body's well being to actionable tips for fresher breath, whiter teeth, and a healthier smile. You'll learn about the systemic impacts of gum disease, effective brushing practices, and even the role of primary teeth in long term health. You're going to take away the do's and don'ts of brushing and flossing. And spoiler alert, your technique matters. You're going to take away how oral health influences heart disease, diabetes, and more, and natural solutions. That's what we're all about here. For better breath and sparkling smiles. The surprising ingredients also to watch out for in your toothpaste and in your mouthwash. So, whether you're looking to elevate your daily dental care routine or you want to avoid serious oral health issues, we've got the insights you need tonight. And of course, as always, I should say tonight. Normally we meet at 7 p.m. Eastern, 6 p.m. Central. As you know, we've switched to the afternoon local time, 4 p.m. Eastern, 3 p.m. Central. So, folks around the world, we're glad you're joining us, but don't miss this deep dive into the everyday tool you know all too well, that toothbrush. And of course, speaking of dental and throat and these sorts of things, the item on the screen is what makes these programs possible in large part. All of the items at the LSR store are there for your shopping needs, for your health reset and resolutions for the new year. That Revitagard is a fan favorite for sure. It's the throat spray that helps during these times of year where we pick up things when we're at holiday events with family or we're traveling, we're in airports, and spray the throat, spray the sinus, and spray the hands. And you've got the three-fold pack there at the LSR store to help you fight off anything that might come your way, boost your immune system, and it's enjoyable stuff too. That doesn't taste terrible. So that's it. As far as the QR code, click on that. And our guest, Linnell DeRue, is now with us. Welcome. Would you tell us just a little bit about yourself? They heard the intro of the topics we're going to talk about. Who is Linnell DeRue? Where do you hail from? What do you do? And what brings you to the dental conversation with our Living Springs Retreat live guests?
Hi, Scott. So I'm not a doctor. I am a dental hygienist. Although that would be convenient if I was, I might have even more weight to what I'm going to say. But nevertheless, I've been doing this for 40 years. I've been in the dental field for 50 years and started out actually in my dad's dental practice, doing simple things like emptying the trash, cleaning the sinks the first year when I was 12. And then I began dental assisting when I was 13. And then when I was 14, I got my x ray license at Loma Linda University. And at 16, I got my dental assisting license in the state of California. That's where I live now. So I've
We
been
have
doing.
something. Sorry,
Go
I
ahead.
jumped in. I should mention to the guests that Linnell herself has picked something up and is fighting something. So if you notice a little throat there, so there's just clear your
Yeah,
throat. And I will not interrupt. I'll give you a second next time to do that.
it's okay. Yeah, my husband got me sick yesterday, so bad timing. Um, so I've been doing clinical hygiene for, like I said, 40 years, but I found that a real passion of mine is doing volunteer work. So I have mission trips that go to Kenya twice a year and once a year to Nepal. And then I have plans in 2026 to go to Greenland. So I'm starting to expand my territory as the Lord leads. Um, so I've got several things, several irons in the fire. I wrote a little book, and I'm in the process of writing a second. That one will be on oral health. But I've enjoyed the road that's been set before me as the Lord's opened doors for me, and it's been quite exciting the last 3 or 4 years.
Well, as you know, that's what motivates us at LSR as well as the mission is really helping people. And so to
Yeah,
hear that that's your heart, I think that resonates with all of our listeners as well,
yeah.
a lot of our viewers tonight. So Give us a little bit on the toothbrush question. That was, as I'm reading the intro and as we discuss these matters, I don't think most people think of that. The toothbrush is really a matter that needs a whole lot of attention.
Attention.
Yeah, tell us about the potential
Exactly.
risks and hazards of toothbrush choice.
Well, people tend to think this is quite boring, and I get that. However, having, first thing I do when I sit down and I put on my gloves and I begin looking in someone's mouth is I can tell if they're right-handed or not. I can tell how they brush. I can tell how they floss if they don't. I can tell what kind of floss they're using, almost without exception. And if they're using a particular electric brush, I can tell that too. And I'll just sit back and ask them, are you using such and such? And usually the answer is yes. So these things matter because when you have a low grade infection in the mouth, that bacteria that causes the gums to bleed a little bit doesn't even need a broken blood vessel to enter your bloodstream. The
Hmm.
byproduct of the plaque in your mouth will cause the blood vessels in the tissue around the teeth to become permeable, and they dive right through like a submarine and get right into the bloodstream. That causes a low grade infection in your whole body, which can precipitate other problems. There is proven, not just associative, but causative, means it causes, gum disease can cause heart attack, stroke, preterm babies, low birth weight, and why am I forgetting the other one?
Diabetes?
Diabetes. Thank you. Yes, thank you. And so these things they have found is like, is it the chicken or the egg? But definitely, in fact, I have a good story for you. I was taking care of my mom. I cared for her for 6 years before she passed. The hospice nurse came in one day, and I had this new postcard size business card sitting on her nightstand. And I was on the other side of the bed, so I was facing the door as she came in, and she pointed to it and she said, "What's that?" She was a real bubbly person. And I said, "Oh, it's my new business card." She asked what it's about. And I said, "Well, it's about the mouth body connection." Her demeanor completely changed instantly. She got very somber and she said, "That's very important." Then she told me a story. She said, "My mother was very, very sick and we couldn't figure out what the problem was. She had sepsis. Sepsis is when you have a bacterial infection in the blood. And they couldn't figure out where this infection was coming from. She had diabetes, severe diabetes, evidently. Well, by the time they determined that it was her mouth, it was too late. She died 2 days later.
Wow.
So, yeah, because this infection was making everything else worse. That was what was infecting her blood. So
Well,
it's serious.
yeah, and normally people think about like I want my breath to not smell bad and I want my teeth to be white and that's kind of the end and that's
That's
fine.
the end.
That's such a first world like you sent me
Yeah,
some of the things you want to cover. You wrote especially in USA. I don't mean to take your
that is
thunder
true.
there. But talk to us about those paramount
Yeah,
concerns and then, what we use our teeth for and just kind of some of the perspective that you have in addition
yeah.
to that.
So I was doing some keyword search for doing marketing, like 12 years ago. And I found that those are the only two concerns that people tend to have, whether they have fresh breath and white teeth. Okay. But particularly so for Americans. But besides that, who cares? So the whiter teeth, it's like, why bother whitening your teeth? It's like, why paint the barn if it's going to fall down? So the foundation of your teeth, holding the teeth into the socket, is super important. In fact, the fresher breath is where that comes in. A lot of people don't realize that their breath odor is not their tongue. Now, there are many causes of bad breath, but one of them is gum disease. And it has this particular odor that I can pick out, like 15 feet away. And I'm not exaggerating. I was at a convention where the speaker was making everyone laugh. And every once in a while, when people would laugh, I get this strong whiff of gum disease. And so I kept looking and I finally determined it was someone about 12 seats down from me.
Oh
So it
man,
was pretty bad. But gum disease is actually death of the tissue in the socket. Can I do a little anatomy lesson?
please.
Let's say this is your tooth. Logically, people think the gums come up to the tooth and just attach. But in reality, the gums come up to the tooth, dip down, and then attach, like my sleeve here. And so this turtleneck or this sleeve around your tooth where you've got two teeth side by side, it extends to little points. It's a freestanding flap of tissue. And when you don't floss, that's where bacteria hides out. And most people, when they brush, they point straight at their teeth, like you see on TV, like this. But the problem is with this turtleneck, you're never going to get inside of it if you're pointing directly at the tooth. You have to angle the bristles down for the downstairs teeth and lean against them. But people don't realize that. And they'll buy one of these brushes that has a round head that does this, and the round head brush won't get under the gums. So this bacteria that's inside this turtleneck area causes ulcers. If you were to lift the turtleneck and pull it back, you'd see that there's ulcers forming in here. And when you barely touch on them, that's where the bleeding's coming from. Bleeding is always a sign of infection. I have patients all the time say to me, oh, my gums always bleed when they brush. And I'm like, if you had an open wound on your hand and it went on for years and years, wouldn't you see a doctor about that? Like, that's not normal to have blood coming out of the body, that it's supposed to stay inside the vessels. So, angling the brush to get it down in the gums so that you can clean off the bacteria that's on this surface of the tooth that the tissue is laying against is really important. If you don't, the bacteria will get into the bloodstream and cause problems. The gums will swell, they get a little puffy, and the bacteria is not content to stay right here in this 1 or 2 millimeters. If you've got two teeth here, this is the face of the tooth. It's about 1 to 2 millimeters deep, and the little point of tissue, it's about 3 to 4 millimeters deep. They're not satisfied to just hang out there. They actually tunnel down the side of the tooth. Now, your tooth does not sit smack against the bone. Your tooth floats in the socket by way of little threads of tissue called periodontal ligament. Peri, like around, perimeter, P-E-R-I, dental refers to the tooth, and the tooth means it holds, or the ligament means it holds the tooth to the bone. It's like a little trampoline spring. So when you chew, your tooth actually bounces up and down in the socket and moves side to side ever so slightly. That's why sometimes when you're flossing, the teeth will be really tight together and other times they won't because they're kind of moving around a little bit. So this bacteria in the turtleneck, they'll eat its way down and destroy the ligament that holds your tooth to the socket. And that's how people lose their adult teeth, because the gum disease has destroyed the glue that holds your tooth to the bone. The disease of that smells like death. Because it's necrotizing or dying tissue in the socket. So if you have chronic bad breath that isn't getting fixed, maybe see a dentist and have your teeth cleaned properly.
That's helpful. It's not just something you mask with gum or a mint because it doesn't even work. And, I know that you teach a holistic approach as well to a whole nutrition, exercise, water, NEW, start, sunlight, temperance, air, rest, trusting God. So probably some of this bad breath is coming from gut and stomach malfunctions too, isn't it?
Sometimes it does. So I've rearranged the letters of New Start.
Yeah, give us yours.
Mine's the answers to health. So A is airway and how air affects your health, but if your mouth is in such a shape because you're tongue thrusting, then you need to have maybe a C.P.A.P. You should have a dentist that specializes in airway what am I looking for? They have I can't remember the name, it's escaping me. So they have dentists that check your airway and even therapists that will help you with that. I've seen a speech pathologist because I was tongue thrusting. The way I was swallowing was pushing my teeth out. I've had braces 4 times, but I corrected that by seeing a speech pathologist and his nutrition. So this is really important. This is something I want to pause on for a second, Scott. A lot of patients tell me, oh, I always have a lot of plaque on my teeth. Okay. What they're meaning is tartar. The difference between tartar and plaque is that plaque can be brushed off. It's soft biomaterial. Tartar is bacteria that has not been brushed off in 5 days. And it now, because it dies in 10 hours, the plaque on your teeth, the bacteria, they multiply every 10 to 20 minutes. They live about 10 hours, they die. And in 5 days, if they're not removed, the cell wall that used to be, made of an organic material is replaced by minerals in your saliva, calcium phosphate. This is actually fossilized plaque on your teeth. That's what tartar is. And it smells badly. Now, the more phosphorus you have in your diet, the more tartar you're going to have on your teeth. Tartar is a layman's term. We call it calculus in the office. Calculi means rock in Latin, so it's this white rock-like substance. And if you have a lot of phosphorus, your body only needs a little bit of phosphorus, just a little bit. All this excess phosphorus is kicked out through the saliva ducts and the kidneys, forming tartar on the teeth and kidney stones. I had a patient right after I graduated. It took me 4 hours to clean her teeth, not because I was slow, but because when she opened her mouth, I kid you not, her entire back teeth were completely entombed in tartar. You could not even see the teeth. So I clean her all up. She went home after the 4 visits, and about 2 weeks after I'd finished, she dropped in because she had a filling that had come out, unrelated to what we had done. So I said, I don't have a patient right now. Come on back and I'll take an x-ray because insurance requires before and after pictures, make sure it's legit. She opens her mouth for me to put the film in. I about fell over. She already had tartar on her teeth. Not plaque, no, crispy stuff. I'm like, what are you eating? And she's like, why? And I said, how often do you have meat?
Hmm.
Yeah. And she goes, incredulous that I should ask that. Like, she said every meal. And I'm like, we need to talk. So I explained about the mineral replacing organic material and the tartar forming directly across from the saliva ducts. So you know how drinking fountains, if you've seen them, they're still around. Everyone carries a bottle. How the opening of the drinking fountain will have this white crusty mineral form. That's the hard minerals, the hard water will form on the opening before it forms anywhere else. So the teeth directly across from saliva ducts will have more tartar buildup because the saliva that's rich in minerals will be washing over those teeth. So you have one in each cheek called the parotid duct and 2 under your tongue that are side by side. And when you close your mouth, they lay forward and point right at these lower front teeth. Because when you go to the dentist, where is the first place they usually start? Right down in here, right?
Mm-hmm.
And so that's where it's usually the heaviest too. So plaque can brush off, tartar doesn't. So I said to her, I still remember her name, Lee. I won't give you your last name. And I said, let's rethink this. So when you go to order a sandwich at a deli, get the vegetarian version. When you're going to have spaghetti, have marinara sauce instead of meat and meat sauce and meatballs. Think more vegetarian and dial back so you're not having so much meat so often, because women, we already have a problem with osteoporosis, and eating all this meat is just going to make it worse. Because guess where your bones, when you're done growing, guess where they give up the calcium, because it's the bones that generate calcium in your body. Your phosphorus molecule is missing 2 electrons. It's a -2 ion, and it's going to marry something with 2 extra electrons so that the body can get rid of it. Guess what it marries? Calcium, because it's
Mm-hmm.
got 2 extra electrons. So now you have calcium phosphate your body can't use, and it kicks it out through the saliva ducts or the kidneys, forming tartar or kidney stones. So she decided to make that change, and she came back in 3 months. It took me, I looked at the clock when I picked her up in the waiting room and brought her back, 20 minutes from start to finish.
Hmm.
Yeah, it made a huge, huge difference. So that the tartar will greatly reduce if you, like, I can tell my vegetarian patients, I'll have couples come in. She's more plant-based and he's a meat and potatoes guy. I'm done in, 30 minutes or less for her, and he takes a whole hour. A
Mm.
lot more bleeding, a lot more bone loss. Yeah, because the 3 places, this is what I meant to say. 3 places that give up calcium in adults is the spine, the head of the femur, and the jaw bones around the teeth.
Hmm.
Now,
Interesting.
Doctors will often look at the wrist. They think these are the smallest bones to see if someone has osteoporosis. Actually, no. We will see horizontal bone loss around the teeth first before they'll see it in the small bones of the wrist. But, they don't integrate medicine and dental, so they don't know that.
So in addition to meat, I mean, you got answers too. You talked about the airwaves.
Yeah.
You talked about nutrition in the meat aspect, and I think most of us, when we think of ruining your teeth with diet, we're thinking of candy and soda. So sugar, of course. What else? And then answers go to sunlight, water, exercise. Do these things actually help your teeth?
Yeah, yeah. So of course we know sugar destroys your teeth. The carbonated water will even do that because carbonation is very hard in the enamel. So you don't want to do like carbonated sodas. I will have them maybe once or twice a year because I've seen one guy came in. I don't have a yes, he came in carrying a bottle of soda. He comes in, sits down, and he puts the cap on. I look in his mouth. He carried this bottle with him everywhere he went. There was on his teeth, I kid you not, a perfect circle of no enamel
Oh.
from doing this, you know, all day long, every day. He had dissolved the enamel on his teeth from drinking soda out of a bottle every day. So don't do that.
No, Linnell,
Um,
I'm laughing, but I can't be one to judge because I used to. Hi, I'm Scott, and I'm a recovering Mountain Dew addict. I would sip on it out of a straw from the Speedway 44 ounce when I'm a delivery driver in college. And then at the parties, instead of drinking alcohol, I'd get 3 liters of Mountain Dew when I was in the world, and I would be just downing that stuff all afternoon and evening, 3 liters of Mountain Dew. So I understand. I
yeah,
understand the addiction there that he was facing, and we can
yeah.
overcome through Christ. I did.
Yes, yes. Yeah, Mountain Dew is the worst. It's like the worst. Second, I take that back. It's second worst because your dark sodas are very high in phosphorus. So you have your meat and your dark sodas. I can't remember what else, but those are the two things that I'll address to patients. You need to dial back or quit altogether.
How about dairy?
Dairy people think that milk gives them calcium. So the reason that milk is white from cows is because it has a lot of phosphorus in it.
Hmm.
That's why bones are white. So milk has a 1-to-1 ratio of calcium to phosphorus. So the calcium in milk is actually not available for your uptake. Your dark leafy greens are highest in calcium, and um, what was it? Sesame seeds, brown toasted sesame seeds are high in calcium. You could do a search online to see what else is high in calcium. Let's move on.
Hmm.
Sunlight. So, in your answers too, sunlight is very important for the health of your bones. Getting vitamin D is going to help you in many respects. Using sunblock will diminish your uptake of vitamin D, and the more melanin you have in your skin, the longer you're going to need exposure to sunlight. So it's very important to get sunlight. It's also good for your immunity. And as you can tell, because I've got a cold now, I was indoors a lot recently and I wasn't taking my D, which I should have. Water is very important. Water instead of juices and like we talked about, sodas, should be what you drink all through the day um, because it's not going to cause plaque. Anything else besides water is going to feed the bacteria in your mouth and cause the bacteria to create a byproduct, which causes bad breath and gum disease and, yeah, decay. So, water is important also to hydrate your mouth, how to hydrate your tissues. Exercise. Now, you wouldn't think this, but exercise actually strengthens the jawbones around your teeth. Don't ask me how the body does it, but it does. So when you exercise, it not only strengthens the muscles and the bones that get that impact, but it also regenerates the bone around your teeth. Now you're not going to bring all of the bone level back up, but you can help arrest, like low grade bone loss, which brings me to something else. And then I'll come back to rest. When you're, I lost my train of thought.
While you're regaining, I just got to say the exercise piece that you just hit, I don't think I've ever heard of a health outcome that is not improved by exercise. So it's like
Right.
it's the most versatile, impacting health choice you can make. And we're covering that next week, January 1, 4 p.m. Eastern, 3 p.m. Central. So be there for that episode on exercise. And we're gonna hit the new year running, quite literally, maybe.
Literally.
Um, yeah. Or is that January 2? It'll come up at the end. It's gonna be no, that one's on January 1. Here we are on a Thursday. Normally we meet on Wednesdays. So we'll be back to Wednesday next week. But yeah, so we're on exercise, helping your
Yeah.
teeth somehow.
So exercise is very important because it, of course, helps your long bones, your the head of your femur, your hip, to be stronger, and to help your spine to not degenerate, and also help your bones around your teeth to not degenerate as quickly. Now, you can't bring the bone level back up, but you can arrest it from getting worse. So let's move to rest under answers two. It's very important to have rest every week because um, your your overall immunity is going to be helped by that. Constantly push, 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 push is not good for your systemic ability to fight off disease. And I was going to talk about other things and not go deep on this. I wanted to just touch on this and talk about something else because I wasn't prepared for going deep into the answers to, because people's questions are related to the things
Oh yeah, yeah.
that
We
are
got to hit
more,
those things. We got to
yeah,
hit those things for sure. And by the way, on the rest, I looked at this article from U.S. News and World Report a couple of years ago, and it was like the 11 ways to live to 100.
yeah,
And one of them was floss your teeth every day,
yeah.
consistently. And another was live like a Seventh-day Adventist.
Really?
And so when you're talking about rest every week, this is a group of Christians who are religious about their observance of the seventh day Sabbath as a holy day and by the Creator in Eden, and
Yeah,
that we refrain from labor on that day.
yeah,
So yeah, you can hit these T and O quickly, and then we'll go to, what is it that we're doing to harm our teeth, and what do we use our teeth for? But T, trust in God. E, oh,
geez.
and O, oral
And
health.
O is
You
where we're
added.
going to pivot. Yes.
Nobody has oral health in their acronym.
No, they don't. No. So I've actually trademarked this. So yeah, trusting God is very, very important, because when you don't, you are going to be clenching your teeth and
Mhm.
bruxing, grinding your teeth. And I saw a tooth fractured in half vertically from someone clenching their teeth. They were going through a divorce and it was just really stressful for them. And so having trust in God, and I rely heavily on the Lord, and just asking him to guide my life every single day, because the day goes so much better when I do. Just making a full surrender to him. It was really scary for me at first. The first time I read actually a book called The Great Controversy. And by the time I got three-quarters of the way through it, I was like, how come I've been going to church my whole life and I've never heard this before?
Oh, I
I
know.
was indignant. Yeah.
You and a
So
million people.
yeah. So yeah, but that was about two-thirds of the way through. And then at three-quarters of the way through, I got on my knees and I said, Lord, whatever it is that is separating me from you, I surrender. I give it all to you. And it was really scary because for me, scary is maybe too strong of a word. For me, it was very um almost unnerving for me to make this commitment, because I knew how things were going to turn out if I had like total control of all the decisions and everything that I was doing. I mean, it would turn out badly, but at least I knew.
Right,
so,
right.
so when I did make that surrender, there is no way really that I have found to describe joy. Joy is different than happiness.
Oh, so true.
Right? Joy is just like, I don't know, it's a whole different um feeling of your spirit, of your being. I mean, it's almost like there's this freedom that accompanies it, and you just emanate is the best way for me to describe it. It just emanates. And so I experienced this joy and I'm like, I want that every day. So it's very important to make a daily surrender because it goes away. It's like your spiritual walk, because you've got an enemy that doesn't want you going that direction.
Hmm.
I've likened it to going up a down escalator. You have to constantly keep moving and advancing to not be sucked back into the world. You have to keep yourself in God's hand.
That's a good analogy. And reading that book, The Great Controversy, is a good way to get started in that effort of
It
seeking the
is.
right path, because that book is life changing. It was life changing to Linnell, to myself, and I said a million. How about millions of people? I'm going to mail a free copy, at least in the United States, to those who are overseas. Just look it up online, right? The Great Controversy, audio book or PDF, and
Yeah.
read that book or listen to that book. Anybody in the United States, email me.
Yeah.
I'm gonna cover the shipping. It's my gift. That's just something that I do through another ministry that I'm a part of, that puts those books out through Belt of Truth Ministries. So just email me,
Excellent.
scottritzema@gmail.com. Say, can I please get a copy of that book, The Great Controversy? It covers the history of Christianity from the Bible times, from the end of the Bible up until the current times, and then prophecy into the future. And that's where it gets really interesting. I mean, the whole book is
Yeah.
interesting,
The
but
whole book is interesting.
yeah, yeah, please take advantage of that. Don't hesitate. scottritzema@gmail.com. Say, please send me that copy of that book. And that's something that we've got funding for and are able to do, and we love to share. So as long as you'll read it, it's yours. Now,
Yeah.
you've got some other dental data
Yeah.
for us.
So let me
Um,
go.
yeah, hit it.
I made a few notes. People think that teeth are boring. Well, let me ask you, what do you use to eat with? Do people enjoy eating? I think we do. Some of us, I eat out of necessity because there's other things I'd rather do. But there's times I really enjoy eating, and it's important to have teeth to be able to chew your food properly. Now, if you don't chew your food long enough, keep in mind, let's realize that your stomach does not have teeth in it. Your stomach is not going to work like a garbage disposal and finish chewing up the food. Let me see. Your your nutrition is going to be gained from the small particle sizes of which you've thoroughly chewed up. And the nutrition is also, the digestion is started in the mouth. And so your nutrition is upped the more thoroughly you chew and you mix it with saliva. And then when it gets in your stomach, the digestion begins, or I should say, it continues in your stomach. So the smaller the particle sizes, the more surface area there is to withdraw nutrition from those food particles. And the my husband used to work as a colon hydrotherapist, and he told me that he would see the stuff that came out of people, and there were sometimes whole pieces of lettuce leaves because people literally just swallowed things whole. You're not going to get the nutrition from it unless you chew it thoroughly. So mastication is very, very important. The more teeth you have, the more thoroughly you can chew. Did you know that people without teeth live a 10-year shorter lifespan? 10 years, because they're not getting nutrition from food. Even if you put it in a blender, you're not going to get it mixed with saliva. I've tried that just to see, for reasons like this, for conversation. You really need to chew your food to have proper nutrition from it gained. Now, your teeth also there's an example right there. Your teeth also will provide your ability to speak properly. I have a friend, named Lewis, who calls every once in a while when he hasn't got his teeth in. I cannot understand him. And I've traveled the world. I'm pretty good at figuring out, with people with water in their mouth, or whatever they're trying to talk about. Let me suction for you. But I've asked him, go put your teeth in because I can't understand you. Having your teeth allows you to pronounce your words and to enunciate properly. It's also important for whistling. If you like to whistle, I use my fingers and I couldn't do it if I didn't have my teeth to push them against. And then for singing, you also need your teeth for singing. So if we're going to sing praises to God and then have a beautiful smile, because your nonverbals is another part that's affected by your teeth, smiling. I had a patient, no, it was, I used to work on cruise ship, and our cabin boy didn't want to smile because he was missing a bicuspid. And so he'd smile and cover his mouth every time. Poor guy. It's really important to have your teeth for not just functioning, but for aesthetics. Because if you want to be taken seriously, you don't want to be missing your front teeth. Isn't the classic picture that we have of someone who's got a lower IQ missing front teeth? Isn't that classic? It hurts their credibility. So you want to hang on to your teeth for more than just functionality, but for aesthetics. Which brings me to whitening. A lot of patients want to whiten their teeth, and the the most common request we have when patients sit down is, I want my teeth whiter. What can I do for that? Well, you can get them done in office. It's a very strong, if you have any sensitivity, don't use the in-office one. It's like a 35% gel, and it will make your teeth really hurt. Get trays. I prefer the custom trays, and you can use like a 10% solution. They can order that from you, or you can even order it on Amazon and wear the trays. It takes longer for your teeth to lighten, but it does work. That's what I use, is the low, like 15%. The white strips, those work too. Definitely, I've done those. And it may make it take a few more doses or applications in this case to get the effect of those, but those work also. Now, if your teeth are crowded, the strips aren't going to work as well because they can't adapt to all the crowded areas. If your teeth are straight, then the strips will work fine for that. Custom trays are great because they'll also keep you from grinding your teeth, but I highly recommend getting a night guard if you are clenching or grinding your teeth at night, because that constant torque of the tooth in the socket. Think of it this way. You have a fence post stuck in dirt, and you push that fence post one direction, then you go to the other side and you push the fence post the other direction. Eventually, what happens to the hole? It gets larger and larger, right? The same thing's going to happen to your bone. You move that tooth, grinding your teeth back and forth, it's going to make the bone level decrease and your gums recede, because the gums are like a horse blanket over the bones. As the bone gets shallower, then the gums follow. So that will cause the gums to recede also. People think that their enamel is soft, or my baby, when I was pregnant, stole my enamel. That doesn't happen. Once your tooth is formed and it's erupted, it's done. Your baby is not going to take calcium from your enamel. Now, your home care may change because you're, up all hours of the night and you're just trying to survive. So your home care habits may change, and you may have more decay or gum disease problems because of that, but it's not an infant taking calcium from your teeth, because that physically cannot happen. Aggressive brushing. Let me pause on this for a moment. Always buy a soft brush. Now, why does that matter? Because you're doing this several times a day, hopefully more than once. Please brush your teeth every time you eat. And you're putting something abrasive on it. Now, when you see these TV commercials, what do? They start on the front, right? Like here, right there. These people are actors. They don't know what they're doing. Don't follow their lead. Don't start on these front teeth. I had a friend at church who literally had brushed off all the enamel on his front 4 teeth from starting there every time he brushed his teeth, because no one told him. He didn't know better. He had beautiful teeth, but he literally brushed off the enamel. Because if you do this every day and you're using a stiffer brush, like a medium, it will take off the enamel instead, because there's usually not much plaque here, almost never, unless you're a child that's like 8 years old and you don't brush, which I've seen that. So on my website, Brush for Life, you'll see instructions for how to properly brush your teeth. And it's very, very comprehensive. I made every video. I have an acronym I trademarked because I needed something easy to remember. And I was using the 5 Ps. And I said, Lord, one day I remember where I was. It was in my bedroom. And I said, Lord, I need something easy for people to remember, because even I can't remember the 5 Ps. And immediately the word smile came to mind. I'm like, smile? I have something more like that. That's like, we talk about smiles all the time. I got nothing else. So I'm like, okay, let me work with this. And I thought, well, I show people where to start and not on the front. And then I show them how to move the brush. And then I keep it at an incline. I'm like, I've been doing this for 20 years and I never realized it.
So it's the S, the M, and the I.
Yes. L
Where
is
you
level.
start, and
Yes.
then motion, and then incline.
Incline. Yeah. 40. So if this is your tooth, you don't want to brush, get this in front of a dark spot. You don't want to brush straight at your teeth. You want to point the bristles. I have patients point it straight down, turn until the outside bristles on this side contact the teeth. So I don't know if you can see that.
Yeah.
Okay. So that's a 45-degree angle. And you want to do that up for the upstairs and lean, down for the downstairs and lean. And then L is level, which you'll see pictures on the website. Pictures worth 1,000 words. It's easier than putting a brush in my mouth because then I can't talk.
Brush for life. Dot.
Calm. And the word for is spelled out. It's not number four. It's FOR. Brush for life. Okay. So you want to make sure that you're not using a medium brush. And by the way, a very good brush, but very expensive, is the Sonicare. Now, if you've already invested in your Sonicare and you have one, then make sure. I've seen a display in a doctor's office where I was temping, and they have like 6 or 7 different heads that you can get. Only one of them is a soft brush, one, and they call it sensitive. None of the other bristles are soft enough, I promise you. The ones that you can buy at Costco are not soft. I didn't know that because they don't label them soft, medium, hard. So you can go online and type in either Amazon or Target.com, Sonicare sensitive comes right up. You can buy that head if you've already invested in Sonicare. Now, if you have a different brush, um, the round head one, just use it to clean your tile. Don't use it in your mouth anymore, please. I beg of you, please, please, please. I had a patient who literally, I'm not exaggerating, was going to lose all, not some, not most, all of their teeth because they had used that electric brush that does this all the time for years, and they had so much advanced gum disease, all of the teeth were loose.
Hmm.
So I beg you, don't use that. Either use a manual or electric. Now on my website, it's sequential. At the bottom of every page is a button that takes you through the site. Um, the first page is the mouth body connection information. The second page is brushing. The third page is flossing instructions because I see 3 common mistakes that people make. And so I have an acronym for that, GPS. And God gave me that too. Anyways, he's good. We serve the best God ever.
Amen.
And then the last page is FAQ. And that's separated. You once you click on that, there's different topics, things people ask me about, toothbrushes, what they ask me about, toothpaste, mouthwash, and all that kind of thing. So when you go to the toothbrushes page, there's a black toothbrush. If you click on that, it will take you through to a site, and it will cookie your computer with a discount code that gives you 40% off of your products. So I recommend going through there because they give hygienists this so that we'll promote their stuff. They give us a free brush at the outset. And so I tried it. And because I'd been using the Sonicare and it had caused recession, every time I brushed, I'm not lying, I cried. It hurt so much. So I saw the burst being talked about in my hygiene groups on Facebook, and I tried one, and it was like heaven. The first time I put it in my mouth, I could brush without any pain because the bristles are really, really gentle. So you'll see pictures of it in the video there and why I like that brush. Anyways, moving on. So toothbrush abrasion, you don't want to start on these front teeth. Start on the inside of the lower front teeth, like that. Okay. All right. You'll see more on the website. And then I talked about cola. Phosphoric acid will dissolve the enamel on your teeth. In fact, there are parents that realize this, and when their child needs to do a science experiment, they'll go to the dentist, get an extracted tooth, and the experiment is to drop it into a bottle of cola, and I believe it's in a week, the tooth is completely dissolved. It's gone.
Unbelievable.
Yep. In fact, I had another patient tell me that he uses cola to clean the battery acid off of his terminals in the car.
Oh,
Look it up.
don't put that stuff in your body, folks. I mean, not just for your teeth, for your gut, top to
Yeah,
bottom,
it's a bad idea.
whole body, your blood quality. Yeah.
Yeah. So there's various things that will cause damage to the teeth, but those are the most common, the diet and the brushing and the type of brush people do. You want to brush smarter, not harder. The
Hmm.
more aggressive you brush, that's the E in smile. Pressing
Okay.
so hard that the bristles bloom and you're using the long side is not smart. The working part of the brush is the bristle tip. Okay. So if the bristle tips start to curl a little bit, then you need to get a new brush. By the way, how to know when to change your brush? Don't look at this side. Turn your brush around so you're looking at the back side. If you can see the bristles, this one's almost ready to change. If you can see the bristles from the back side of the head, that's when to change your brush. You can sanitize, which reminds me, I have a freebie. You can sanitize your brush without, if you've had a cold, without having to throw it away. Like you've just opened a new brush, you don't want to toss it because you're sick. Um, so if you go on my website, there's a green button, and it asks something about fresh breath. Do I have it here? You can click on that, and it will give you a link and a video to watch. I made a really good video about the mouth body connection, and you can click on that and then enter your name and email, and I'll send you what I call the fresh breath formula. And that will be a very good substitute for over-the-counter mouthwashes. That's something I wanted to talk about. Yeah, the button says, is your breath fresh? You click on that. Mouthwash. A lot of people want to skip flossing and use mouthwash instead. Okay. Mouthwash is only going to get 1 to 2 millimeters under the gums, according to research. Okay. You must use floss. There's the floss. Very important, because that's the only thing that's going to get under that little flap of tissue between the two teeth and wipe 40% of the tooth surface clean. Your toothbrush gets 60% of the tooth, but the other 40 is only reached by floss. So you're going to need to use floss. Now, what about floss picks? A lot of them are made with Teflon. Teflon is used for plumber's tape so the pipes don't stick. Teflon is used in your fry pan so your eggs don't stick. Teflon, if it's used as floss, is pretty much like trying to floss with Tupperware. It's not going to take anything off because there's no
Hmm.
fiber to it. It's I like this floss. This is the burst floss, but there's others. I don't know. Can you see that? See how it's fluffy? It expands a little bit.
Mm-hmm.
Okay, there you can see that. Okay, floss that expands or that's woven, the best. Get that. Waxed or unwaxed, it doesn't matter. But Teflon floss won't say Teflon on the package. Costco only sells one floss. That is Teflon floss. It comes in a little gray box or a little blue box. That's Teflon. If it says easy slide through, that's Teflon. It takes nothing off your teeth. I had a patient that was using it every single day religiously. She had burnished the plaque and tartar onto her teeth. It took forever to clean her teeth. I had to keep resharpening my scaler because it was so burnished and
Hmm.
polished right onto the tooth. I tried using polishing paste to get it off. It wouldn't touch it. So use floss that has fibers to it. Now the floss picks, almost all of them are made with that Teflon. So there is one when you go to my site, if you go to the FAQ and you click on floss, you scroll down the page, there's images of products that I suggest to people for using to get the floss, the bacteria out between your teeth and under the gums. There's one called Angled Flossers by Gum, and it's this shaped, not this shaped. It's like this. And they use, not that the shape matters, but that particular one uses regular floss that works. So you'll see that on the site. You can click and it takes you to the Gum website.
And just give your URL again. I think a lot of folks are going to want to be checking that out.
Sure. Brush for Life. I should have written it down. I should have a placard that I made and hold it up.
Brushforlife.com.
.com. Yes. Yeah. Now, going back to what can we talk about here?
Well, you're looking for it. We've got a listener that says everybody needs to watch the documentary Root Cause before going to the dentist. Are you familiar with that documentary, Linnell?
I am. Let's talk about the root cause and let's talk about fluoride. Oh, mouthwash. I was going to talk about that. So on my site, remind me to come back to these other two topics.
Okay.
On my site is a link for clicking about to learn about to make your own mouthwash. Most mouthwashes, not all of them now, but most of them are made with alcohol. Alcohol is what's used to dissolve some of the oils and the other chemicals that they use in mouthwash. Also, I had a patient who's got like green or blue stain on their teeth because they're using mouthwash every day. The dye was actually adhering to their teeth. So you
Hmm.
don't need the dye. You don't.
I use iodine for mouthwash. Am I barking up the wrong tree with that?
No, no, I haven't. Do you dilute it at all?
Yes.
Okay, yeah, then there should be no problem. I know there's an iodine. I just was using it today in my nebulizer that's clear. But you can swish with that. If it causes any staining, if it's the red kind, I imagine it might, but that will polish away. Just make sure you get your teeth cleaned regularly.
We've got another viewer who also says, what is the best natural product to kill bacteria in the mouth? I guess probably your whole program is, I mean, you got to do it all, right?
The fresh breath formula is your answer.
That's where you're going next, isn't it?
Yeah, that's what I was going to get to. Yeah. So there's products that you can pay some good money for that the majority of the content is water. You're buying water. And we're kind of used to buying water nowadays, but it didn't used to be that way, 20 years ago. Um, but you can make your own for pennies. Literally, one dose is like a penny or less. Um, and you can make that, and it will kill the bacteria that cause gum disease and mouth odor. Not all of them that cause mouth odor, but it's a little recipe that you can put together, and you opt in for that, and that will help. Now, there's been research that's been done. It was in Australia, and because there's big money in mouthwash because it's a consumable like toothpaste, they don't want to have you know about it. So it's
Hmm.
pretty well buried. I had to search for it because I had heard of it, but I did find it. And on the top of my website is a red button that says recommended items. You click on that, and it will take you to the study, and you can read it for yourself. So that's on the home page at the top. You click on that, and you go down. Um, where is it? Mouthwash, second item. Click on that, and it tells you more about mouthwash. So all the things that I've been talking about are on my brushforlife.com site in that red button. When I did a podcast earlier, I made this so it's easy for people to find more information there.
Excellent.
Fluoride is a neurotoxin.
Yeah, I wanted to hear on fluoride. And then Danelle is saying that she has the same question. What do we use to cure gum disease? So you got those both in the hopper, but I'm very interested in your fluoride conversation.
So fluoride affects many things. I'm working on a master's degree in global health right now. And one of my reading reports I did was on fluoride because I thought let's just tackle this one and get this, kill many birds with one stone. So it's a neurotoxin. It causes lower IQ. It causes weak bones, in developing children. Um, it's just not good for you. We do not grow old and have problems from a fluoride deficiency.
Right.
We don't have that.
Vitamin
Um,
D, maybe.
yeah, vitamin D. So now the fluoride in your water is not going to be taken up by your enamel. In order for the enamel to be strengthened by fluoride, it has to be in contact with the enamel for like 30 minutes. You're
Hmm.
not going to hold water, and it's so minuscule. It's like putting fluoride in our water supply is like putting statin drugs for people that have heart conditions.
Right.
Not everyone has a heart condition.
Right, it's mass medicating the population with no
Thank you.
ability to control the dose. And by the way, I am doing this is so funny you bring up fluoride because I'm literally doing an interview on Belt of Truth on YouTube. You'll find it Scott Ritzema Belt of Truth on the topic of fluoride with Dr. Tim Pernick right after this. So more
Perfect.
on fluoride over there. I want you to be able to get to all your topics, but I'm glad you hit that one because I've been wondering for years, and I'm from Grand Rapids, Michigan, by the way. I'll tell more of my story in the other stream, but it's like that's where fluoridation of the public water supply started, and we're so proud of it in Grand Rapids. And I'm like, no.
Someone gave me a VHS tape on this topic, just a random stranger in a health food store in Sacramento, just about 25 or 30 years ago. 25, yeah. And they really were insistent on me watching it. They found out I was a hygienist, and we were talking in the toothbrush aisle. and and so I went home and watched it. And so at that time, the internet was in its infancy. Okay. And I did a search. I typed in the words on Google, fluoride and toxic, and I got a whole litany of hits. And just the first two were really, really good. Really good. You do that now, they do not appear.
Oh no. No, they've
They're,
got a good they've
they're
got control over
very,
things.
yep, yep. And you can even go to Google Scholar, which is where I initially got my information for my article, for my book report. Went back to find it, and I couldn't find it. I'm so glad I
No,
copied down the link. It's buried.
that's
It's there, but it's also buried, even though you're going to Google Scholar. So
That's called the memory hole in your Orwellian terminology. And Carrie Sanders, by the way, before we transition from fluoride, that interview on fluoride is 5:45 p.m. Eastern, 4:45 p.m. Central. So that's what I mean by right after this. So that's going to
yeah,
air over on Scott Ritzum, A Belt of Truth. But Carrie is saying, yes, you can smell gum disease and dead teeth from across the room, agreeing with your comment on that earlier. So it's good to have our viewers chiming in. And Danelle says, again, thanks for explaining how the gums attach. That is helpful. You did a good anatomy lesson for us, Linnell. They're appreciating it. And
excellent.
another viewer says a lot of learning a lot here. So yeah, absolutely. I'm learning a lot as well.
Someone
Please jump in.
Someone has asked about using a water pick. I'm so glad you asked. So on my site, because patients ask me, people, I understand, I get it. People want to avoid using this. You can't see because of my hair. They want to avoid using dental floss. This is burst floss. Someone asked what kind of floss do I use? I use the burst because it's black. It has charcoal nanoparticles, so I can see what's coming off my teeth, which I find fascinating. But it expands. It's got good tensile strength, which means it's not going to shred. There's others on the market. So under the recommended items, I've got 4 flosses that I have used. And so I list them there because I want to put down things that I actually know about, that I have, physical use of. And then also which ones I recommend for what purposes. The water pick. Okay. So there is this physiology, physics, principle of physics called magnetohydrodynamics. It's a real thing. What they do, they meaning people in the civic service industry, these very, very large, I can't even get my arms big enough, huge, huge water conduits will, they're not going to want to replace those. They have found by putting magnets on the outside of them, it prevents minerals in the water that's passing through from adhering to the inside walls and slowly closing the lumen, the opening of these pipes, because it forces the minerals to stay, what's the word I'm looking for? Suspended in the water, excuse me. And so some brilliant individual decided they would try putting magnets in the handle of a water irrigating device. It's a real thing. It made the tartar on a patient who had cerebral palsy fall off his teeth. This young man could not use his hands. As you know, cerebral palsies are not able to do that. So he couldn't floss, and these lower front teeth from here to here didn't stand up like yours and mine. His lower teeth slanted towards his tongue
Uh-huh.
about 45 degrees. I couldn't get back there to clean his teeth properly. So I said, my dad's a dentist. He swears by this thing. I haven't had anybody use it, but we don't have any options. So you might as well try it. He bought one, and it literally made the rest of the tartar that I couldn't reach come off his teeth on his own. Studies show, they've done 5. It reduces tartar buildup by 65%. That's a lot. So I've had a continuing ed class that I took by periodontist who was placing implants. He actually issues the hydrofloss to the patient with their implant to make sure they have something that will keep the implants clean, so they're not doing something to damage it. So if you're going to
Yeah.
use a water pick, don't get the water pick brand, get the hydrofloss. It's available through my website. Also, will take you right through to a purchase page, which, listen closely, will be cheaper cheaper than Amazon and cheaper than their website. because they give you it for free shipping. So Amazon wraps in the shipping costs, so it will cost more if you get it through there. So you can get it through that other site. I'm trying to do things the fastest, the easiest, and the most economical for you. So that's why I have my own little website.
Excellent.
It's
Excellent.
not,
Brushforlife.com.
yeah, it's
Maria asks, oh, go ahead. Finish your thought.
no, it's not to make money on. I don't make, pennies maybe. I don't even know, but it's just pennies. I don't even pay my monthly fee for this. I pay $50 for the platform and nothing ever comes. I just pay it out of pocket because I want it for my patients.
Well, we hope those pennies do come in for you and help you get to Kenya for your medical
That would
missionary
be
trip. So
great.
Maria says, how do I get rid of periodontal disease?
Use the first of all, you need to use the brushing and the flossing method I'm showing you. Okay. Um, I've had a patient who I cleaned her teeth and I showed her how to use the yarn. It was a single tooth. It was scheduled for extraction and an implant. And I cleaned it really well, showed her how to keep it clean and saved the tooth. The doctor was so mad at me. He was so mad because he was counting on this expensive treatment. He was going to do an extraction and an implant with a bridge. So, well, yeah, he was so mad at me, but it does work. So you can, but you've got to get, if you've got measurements, I should do a whole talk on this. The little pocket around your tooth, the turtleneck, it's like I said, 1 to 2 millimeters on the face of the tooth. Because of the little point, it's freestanding 2 to 3 millimeters in between the teeth. And deeper than that, you're down into the root area where it should be attached or should be ligaments. So 4 and deeper. 4 is flossable. 5 is usually flossable and with a toothbrush used correctly. 6 and deeper, you really need to have an appointment where they're going to clean your teeth properly and do a good job. You want to make sure that you have a hygienist that uses sharp instruments. Don't settle for just the Cavitron. That's the electric scaler, uses a lot of water. It's great for getting off big pieces. I actually have now found that I'm getting into the weeds, but this is important. It's going to be helpful. I found that polishing first with a coarse polishing paste removes all the easy stuff,
Hmm.
which eliminates tissue trauma when the hygienist is cleaning my teeth. It cuts down on the amount of time I have to be in there. How do I get rid of periodontal disease? I'm telling you right now. Cuts down on the amount of scaling that we have to do, especially if your scalers are really sharp. And I sharpen while I'm working because the iron in blood dulls the edge of the blade just like that. I can feel it. I do 2 or 3 strokes and I can feel it's losing its edge. I'm really particular. Um, so if you get your teeth cleaned really well and then you follow the brushing instructions that I've got, along with the floss, if you've got really deep pockets, you're going to want to use an end tuft. Um, and I know I'm taking a big risk putting this out there, but my contact information is on my website. So I really do answer my phone. My phone number's on there.
Good.
And my
Good.
email is down. My personal email is on there. Um, are yearly x-rays too much? No. The amount of x-ray that you get is less than what you're going to get for a full mouth set of x-rays, less radiation than you get flying from Los Angeles to New York.
Huh.
The speed of the film is so fast, even though there'll be a long buzz, it's to make sure we don't lift up on the button prematurely. But the flash of exposure and the sensitivity of the plate is worlds better than when they first invented x-rays. In fact, people don't realize this because it would be almost pointless because it'd be more than it's worth to do a public education campaign. The lead shield now, they've determined, and I've wondered about this, completely not necessary. You
Because
don't
it's so
even need it.
targeted.
Yeah, because it's so targeted. Because inside, that cone that they put against you, the tube, inside of that is a lead washer with a hole that's just the right size for that. So it blocks anything that's scatter and extra.
Fascinating. One of our listeners, one of our viewers says we should have all learned this when we are young. Yeah, when I was in grade school, it's like take your fluoride. What did they call that? The stuff they give you. Barbara says, how can I stop gagging when brushing your teeth?
Start in the front and slowly get yourself used to using the toothbrush. Maybe I brush without toothpaste because what takes the plaque off your teeth are the bristles. It's the friction of the bristles on the teeth and the friction of the floss That's what tears up the bacterial colonies. So you want to use, thorough brushing. I actually brush my teeth. And then because I have used a dye on the teeth to show patients where they're missing, or they've told me I've just brushed, and I'm like, really? Let's look at this. Let's revisit this. I'll put the stain on. And when we were kids, they had a little red tablet. You could chew it up and it would show the pink. Well, now they have one that's two colors. It turns purple if it's been there longer than 24 hours, blue if it's decay, and pink if it's been there less than 24 hours. So there'll be all this purple along the gum line and between the teeth. And I'll show them proper brushing and do hand over hand so they get the hang of it. I go to the sink and I rinse out the brush real well. At the base of the bristles, it's all purple still. Your
Hmm.
brush holds so much bacteria. So what I suggest is you use the liquid soap at your sink, put it on the side of the brush, work it through the bristles a little bit, rinse it out real well. It'll clean your brush very, very well. So
That's interesting that you just said you don't use toothpaste when you brush your teeth without toothpaste.
I brush my teeth without toothpaste, and then after I've washed out my toothbrush, I'll put a little smear on there to get the nice flavor taste, because it does make your mouth taste nice, minty, fresh. And I'll brush my tongue, and I give the inside of my cheeks, because the purple, the bacteria they're indiscriminate. They're not choosy. They stick to more than just your teeth. They stick to the dead cells. Your gums and your cheeks are constantly shedding that top layer of skin. Just like out here, you know how if you got an itch, you'll scratch and it gets kind of white and flaky because the top layer of cells are always being shed. Same
Mhm.
thing happens in your mouth. So you use your toothbrush through the inside of your cheek and it exfoliates that, and you'll get that just brush, fresh breath feeling last a lot longer because you've knocked down the bacterial count.
Fascinating. In the 1920s, I think it was. I mean, that was when Madison Avenue and consumerism was coming about in America. And I remember reading in a history of marketing or something like that, a book that I was reading or listening to rather. They were talking about how toothpaste was marketed by its foaminess. And that was what got people convinced, like, oh, that's really how you have dental health is the foam of the toothpaste, just like we have suds when we wash our bodies with soap. And it was this big marketing, a gimmick, I guess. Bernadette says, accidentally came across your show. Hey, welcome. We love having you here by accident. Maybe that's God's providence because we love having a growing community of people interested in these things. The female, sorry, I couldn't see her name. That, of course, is Linnell. She is superb. I think we all agree at this stage of the show. So thanks for being here, Bernadette. She's heard things that she's never heard before. Yeah, and the other guy was like, "Why didn't we learn this when we were kids?" Or kids today should be learning it because we know
Right.
this now. Maybe some of this we didn't know 30 years ago, 40 years ago, or whatever. But oh, Bernadette is from Scotland. Welcome from across the ocean. We've also got the dawn is near Evelyn, who says thank you for the information.
There's some questions I want to answer
Oh
here.
yeah, please jump in. You're in the chat there. That's great.
Okay, how about charcoal? Using charcoal is not a good idea because the particle size, A, it's sharp, and B, it's too large. So it's too abrasive. Please don't use it. Plus, when charcoal was all the rage, some of my hygienist classmates were telling me they'd use the Cavitron and go under the gums to get this black line that was showing up under, because they were pushing the particles, not realizing it, into the tissue, and they'd have these little black clouds go poof poof as they're cleaning their teeth.
Oh,
So there used to be a charcoal toothpaste on the market called Black is White, I think, but I think they went out of business. And it had the smaller particle size. I would simply steer clear of charcoal, just to be on the safe side. Don't use it out of the jar, please.
as a toothpaste.
Yeah, as a toothpaste, in other medicinal ways, absolutely. You know, I've used it as a poultice. It's great stuff. My
Great.
son's cavities were reversed by brushing with baking soda and rinsing with peroxide. Okay, um, if they were very superficial, very small in the fissures of the teeth, no, they would not be. I guarantee you. I guarantee you, because I've seen teeth cut in cross section, and it's not a good idea. If it's in between the teeth, the best thing to stop small cavities, if a dentist is watching something, is this: using floss. Constantly keeping the surface. I had a patient who was missing a tooth on the bottom and the front. I showed him how to use yarn or gauze, like cheesecloth, to keep that area super clean because he was getting a cavity there. The enamel was soft. I could get my instrument in there and it'd go doing when I go to pull it out. That's how we know if it's decay. He kept it so clean when he came in. The enamel, it wasn't deep enough to have gone through to the dentin because enamel's like a hat on the tooth, a hard hat. Um, and it hadn't gone through the enamel yet. He was so mad that it wasn't decay. I don't understand. Why are you angry? You saved yourself a cavity. He's like, it was there. I'm like, yeah, but it's not now. You did a good job. I don't know what to say. So if it was between the teeth, it's very possible. Okay.
Great. By the way, on the screen, we've got Dee also, who is bringing up tonsil stones. Do you want to comment on that? And then also, I'm wondering about hydroxyapatite. So there's two more for you.
Okay. Tonsil stones, that is not something that I've encountered in my 40 years. I don't know why. It just hasn't come. Now, watch. Next week, I'll have a patient with them. I know that they smell really badly. You would have to, I'm not sure what causes them. I don't know much about them. I'm so
Okay.
sorry. They're
No,
not
that's
my
fine.
wheelhouse. Yes.
Hydroxyapatite, and then also I just got to give an amen to that comment. We are created by God, and His seventh day Sabbath is the day of rest. So
Oh,
we've
Heartland.
got
I
somebody
just
from
did an
Heartland.
article.
Oh, go ahead, please.
I just did an article for Heartland Magazine. It was
Nice,
published
nice. Yeah,
in
Heartland Institute. They're in Virginia. They're great. We love those folks. So thank you. They said thank you for the live, and we've got a custom made mouth guard. Yep, because Linnell was talking about teeth grinding
yeah,
very serious. You got to have a night guard. So we've
yeah.
hit some things. Read God's word every day. Yeah, that's how you get to trust in God. You find more peace and the joy. I loved your piece there on your component on joy. Your little message on that. That was so good. What about graying teeth? And then feel free to take hydroxyapatite too,
Okay.
back to back.
So graying teeth, our teeth darken as we get older. And it's because the enamel is made of what's called enamel rods. They're actually like straws with a plug at the end. And all these plugs are like little tiles with no grout in between. And they form a nice, smooth, glassy surface. But nevertheless, over the years, the food and stain, color in food and drink can permeate that little plug at the end of the tube, and it causes the teeth to get darker as we age. Now, grain of the teeth, specifically grain, typically indicates that the tooth is dying.
Mm.
The tooth will turn a gray color as it begins to die. So I would see a dentist and have an x-ray done. The x-ray is not going to hurt you, I promise. It's well worth it. I'm trying very hard to get an x-ray machine device donated because we're doing this dental treatment in Africa and we're doing it blind. So I'd really like to be able to see what's going on. Grain of the teeth. So that usually means the tooth is dying, and staining or the teeth becoming more yellow as you are older is because they need bleaching. And I know I just had a dentist show me that I use burst floss. Someone's asking that. That the surface of the enamel becomes somewhat damaged microscopically from bleaching. What's the trade-off? Do I want whiter teeth that I'm keeping really clean and I'm flossing? And they may have these micro, and I'm talking micro pitting, or do I want them whiter? I will take the whiter teeth. Because I take good care of my teeth. The website name is Brush for Life. I don't know if you're able to put that on the screen.
Yeah, brush, F-A-O-R, sorry,
I
brush,
want to,
F-O-R, life.com, brushforlife.com. And the four is spelled out F-O-R. John says, HNY 2025 folks from England, a question for you guys. Are electric toothbrushes adequate to use health-wise?
yeah, they are. I use the burst. It depends how you use it. So I find gum disease results from either product or process. One of those two things I can address, or sometimes I have to address both, and we're going to get a better result. So electric toothbrushes, as long as it is shaped like a conventional toothbrush, you see how there's rows of bristles here? That's the shape I want you to have, not the round head. Please do not get the round head. Speaking of health-wise and getting good results, and people are wanting the website, I have made these mirror clings. So this is a thin piece of vinyl that sticks to your mirror. There's no adhesive, there's no gummy stuff here. It clings to your mirror and it has all the instructions. It has the QR code that takes you directly to the videos, so you can review that if you need to. And then the GPS for flossing to help remind you. And these are pretty inexpensive. So, and you can scan the code, the QR codes for more.
Great.
And then I also have this that I made for professionals. So on one side, it's a handheld poster because I make the large size too. And it has some of the 57 diseases associated with gum disease. And then it has the same instructions with some pictures on the back and a QR code to take you to the site. So these are available for purchase too. Um, but I usually don't talk about those because that's usually for professionals. But the mirror cling is great. I took several of these to Africa one time, and I volunteered at a girls' rescue home, girls that are at risk for childhood marriages. And we put these on the mirrors for the girls. I gave them some
Oh,
instruction. So
good.
it's really helpful when you're going to have a lot of people coming through, in a dormitory or anything like that. And these you'll find on the website under professional health professionals. You can click on that and see the poster and order them there if you're in that field or if you want one for whatever reason. I had a
Yeah,
doctor buy one for his office because of the mouth body connection.
that's
Okay.
great. Glad you provide that. And John, Happy New Year to you also. I just figured out what HNY means, so thanks for your patience, everybody, on that. But yeah, what's next, Linnell?
Can enamel regrow? No, it can't. Once you've destroyed it, it's gone. So preserve what you've got. Root cause. Yes. Thank you for that question. So I learned a lot in reading about that, and it makes sense because I remember my dad talking to me about how he did root canals. He was very, very good at them. Nevertheless, the nerve and blood supply, let's say this is your tooth, like here's the roots and here's the crown. Um, the root of the tooth will have little tiny, almost microscopic blood vessels and nerve supply that innervate the whole root. Yes, there's a main chamber, but it's like tree roots going down. So when we do a root canal in the office, you're going to get that main one cleared out, and they'll put something in there to help. Different dentists do it different ways. Um, some dentists will put an antimicrobial in the root canal, the canal that was holding the nerve and the blood supply, and leave it there for a period of time. I don't know, a few days or a day, and then have you come back and they finish the root canal in hopes that it will permeate all of these little tubules all over, and the nerve and blood supply, the branches. Doesn't always work that way. You may have bacteria that has been killed, and then you may have some that hasn't, and over time, if it wasn't thoroughly killed, then you'll have it blow up. And the pain from a tooth that has an abscess is all of that pus that was bubbling and percolating in there goes out the bottom of the root tip. And then it forms an opening or a little sac in the bone. It has I'm lost for words here. Radio translucency. We can see when there's an abscess forming before it, that the pain is where the pus has nowhere to go. Sometimes the pus will tunnel through the bone and drain into the mouth, and you won't have pain. You'll have an abscess and not be aware of it because the pressure is released from it coming through the face of the jawbone. So it's probably a better idea to have I'm not saying everyone has to do it this way, okay? And I'm not trying to give you dental advice, but it's maybe a better idea to have the tooth removed and have the implant put in there. And when you remove a tooth, it's a good idea to put bone in there and have a bone graft put in so that you have lots of bone for an implant to go into. And then they suture it up. They wait and go through all the process of that. So,
Very helpful, Linnell. And folks, you realize you're only getting a fraction of
yeah.
Linnell's content, advice, tips frankly, sometimes it sounds out like hype, like the secrets of such and such revealed, but actually that's true with Lynell because she's telling us stuff that folks aren't aware of, aren't hearing, and I think this is highly valuable information. I know our viewers feel the same way. Brushforlife.com. That would be like my kids are going there. We're doing part of our homeschool. It's going to be dental health and relearning what we thought we knew. So I appreciate the conversation, Linnell. Yeah, give us some last insights, and we'll say
Yes,
bye to
listen,
folks and tell them about next week's program.
one more thing. At the bottom of brushforlife.com, in the footer is a QR code, which is also a button. You can either click on it if you're on your mobile, or scan it if you're on your whatever. And on it will take you to like a online business card that has all my links. It has the website for my mission work. It has a website for a little book that I wrote, and it has my social media links, and everything is on there. It's Linktree / Linnell Daru.
Well, I think I want to have you back for a Q&A session on dental and to hit anything that we didn't hit because I know you've got, books and knowledge, 40 years of experience at this that you can bring to the table. So I think we need to do dental health again another time. And for now, folks, in the meantime, just spend some time on the website there. And we will see you all on our next episode of LSR Live. Join us as we talk to the LSR team on healthy exercising to start off New Year's with a healthy start. See you Wednesday, January 1st at 4 p.m. Eastern, 3 p.m. Central. Bye to all. Linnell says bye, and
Bye
Scott
bye.
Ritzema says bye to you all. And of course, thanks to our producer, Christian Digital Network. From likes to lives changed. Scan that QR code. Subscribe to the CDN YouTube channel. Jeremy, great job tonight. Thanks everybody for joining us, and we'll see you next time. God bless you all.